Assalamu alaikum. Today I would like to discuss about some eye problems. This is a high yield eye problems. First of all, the picture shows this is a picture of age related macular degeneration. Age related macular degeneration. And in age related macular degeneration, these are of two types. One is dry and another is wet. Dry and wet. And what happens in here, there is degeneration of the macula, that means central artery of retina, and it causes distortion and eventual loss of central vision, which is called scotoma. I have already said that there are two types of age-related macular degeneration. One is dry and one is wet. In dry, what you have to remember, in dry there is deposition of yellowish extracellular material called drusen. Look, this is the yellowish deposition which is called drusen. It is located in between Bruch's membrane and the retinal pigmented epithelium with gradual decrease in vision. It is prevented by multivitamin and antioxidant supplements, and as well as zinc can be used. And in wet, which is exudative, and dry, which is non-exudative, dry is 80 to 85%, on the other hand wet is 10 to 15%. In wet there is rapid loss of vision due to bleeding secondary to choroidal neovascularization, and it is treated by dry for drusen and deposition. What you have to remember, the key point, dry is drusen body and deposition of the yellowish extracellular material is called drusen body. Deposition of extracellular material called drusen bodies. And in wet there is rapid loss of vision due to bleeding, and in here you can use vascular endothelial anti-VEGF, vascular endothelial growth factor inhibitor called bevacizumab or ranibizumab. You can use a new drug called aflibercept. And in aflibercept is also used in other area like metastatic colonic carcinoma. It is used in colon cancer. It is used in this place, that means age related macular degeneration. This is the first picture which is called age related macular degeneration. The next one, this is the picture of the diabetic retinopathy. We know that diabetic retinopathy happens in a patient who has a history of chronic diabetes. That means he has suffering from diabetes for 15 to 16 years. This type of patient, usually this retinopathy happens, and these are of it is happened due to chronic hyperglycemia. These are of two types. One is non-proliferative, second one is proliferative. In non-proliferative there is damaged capillary leak blood, lipid and fluid seep into retina. That's why there is hemorrhage. Look, this is hemorrhage. That's why there is hemorrhage and macular edema. And what you have to do is to control blood sugar. And on the other hand, in proliferative there is chronic hypoxia results in new blood vessel formation. So what you have to do is to stop the new blood vessel formation by giving VEGF, that means vascular endothelial growth factor. You can give bevacizumab here, or you can do retinal photocoagulation, and you can do surgery too. This is the picture of hypertensive retinopathy. Hypertensive retinopathy, it is also happened the patient who has long history of hypertension. In here you can remember a mnemonic called sac puppy, that means silver wiring, arteriovenous nipping, cotton wool spot, and papilloedema. These are the four important features present in hypertensive retinopathy: silver wiring, arteriovenous nicking, and aneurysm, and cotton wool spot, and presence of papilloedema requires immediate lowering of blood pressure. In hypertensive retinopathy, there is association with increased risk of stroke, coronary artery disease, and kidney disease. And you know that in hypertension, hypertension can hit your kidney, can hit your brain, can hit your kidney and causing CKD, can hit your brain causing stroke, can hit your pancreas and causing these and can it can destroy everything. Actually, we are not caring about the hypertension, but hypertension is an important disease. Now, this is a picture of retinal vein occlusion. This is a retinal vein occlusion. What happens in here? There is blockage of the central or branch of the retinal vein due to compression from nearby arterial atherosclerosis, retinal hemorrhage, and venous encroachment. What you have to remember in retinal vein occlusion, there is blood, this blood and thunder appearance, blood and thunder appearance. Always try to catch the key points, because it is not possible to remember everything what you studied from everywhere. What you have to do is to identify the key points and keep it in your mind. Like I can say it that in age-related macular degeneration, there are two types: dry and wet. Dry deposition of the yellowish material, Rosen body, and in wet is bad. In wet you should use VEGF. In wet you should use VEGF, that means bevacizumab, ranibizumab, and another drug called aflibercept. And next one, a diabetic retinopathy. It happens due to chronic hyperglycemia. It is two types: non-proliferative and proliferative. Proliferative is bad. For stop proliferation, you have to give VEGF, that means bevacizumab. And you can do peripheral retinal photocoagulation, you can do surgery too. And most important thing, you have to control diabetes. In hypertensive nephropathy, what you have to do, you have to control hypertension, and you have to remember this sac puppy and silver wiring, arteriovenous nicking, cotton wool spot, papilloedema, immediate lowering blood pressure. And in retinal vein occlusion, what you have to do, what you have to remember, there is uh, blood and thunder appearance. And next one is retinal detachment. In retinal detachment, there is separation of the neurosensory layer of retina, separation of the neurosensory layer of the retina. As Ajahn is going, so I can take a break for 1 minute, then I will start from retinal detachment. This is a picture of the retinal detachment. This is the picture of retinal detachment. In retinal detachment, what you have to remember that there is degeneration of the photoreceptor. That means rods and cones are separated. Degeneration of the photoreceptor and results in vision loss. What happens in here? There is separation of the neurosensory layers of retina. That means rods and cones from the outer pigmented epithelium. That's why there is degeneration of the photoreceptor and vision loss. And detachment, diabetic traction, detachment, diabetic traction. Already I have said that degeneration. Always try to find a relation in between. That means detachment, diabetic traction, degeneration, degeneration, and there is direction of the vessel is changed. Direction is changed. Direction of the vessel is changed. Direction of the vessel is changed in here, and most of the patient have high myopia. In retinal detachment, most of the patient have high myopia and history of head trauma. History of head trauma. History of head trauma. And another two thing you have to remember, this is high yield, that in here there is flashes and floaters. Flashes in here there is flashes and floaters. And other thing that is that there is curtain down drawn, curtain down drawn, flashes and floaters, flashes and floaters, and curtain down, curtain drawn down, eventual mononuclear loss of vision like a curtain drawn down, curtain drawn down, flashes and floaters and curtain drawn down. These are the important two things you have to remember in retinal detachment. This is the picture of central retinal artery occlusion. In here there is acute painless vision loss. Acute painless vision loss. In here there is acute painless vision loss. In here there is acute painless vision loss, and there is cherry red spot at the fovea, that means center of the macula, and evaluate for embolic source. Evaluate for embolic source. You have to remember cherry red, acute painless or monocular vision loss, cherry red spot at the fovea, cherry red spot at the fovea, and evaluate for embolic source. Example: cardiac artery atherosclerosis, cardiac vegetation, and patent foramen oval. Sorry. This is the picture of retinitis. This is a picture of retinitis pigmentosa. Retinitis pigmentosa. In here there is painless progressive vision loss with night blindness. Painless progressive vision loss with night blindness, and there is a bone spicule shaped deposit around the macula. This is a bone spicule shaped, bone spicule shaped deposit around the macula, bone spicule shaped deposit around the macula. This is the picture of papilloedema. It happens due to raised ICP, intracranial pressure. It happens when there is head trauma or other mass effect, and and with the blurred margin. And this is a picture of Leukocoria, that means loss of red reflex. Loss of red reflex. An important cause in children include retinoblastoma, congenital cataract, toxocariasis. These are the important features in leukocoria. Inshallah, you will be benefited.